Hello, everyone. Today we're going to review two research related to the same topic, which is music therapy. As you know, health specialists are all the time trying to fight for new options, new treatment options to offer to their patients in order to help them to overcome very specific diseases. Today, we will analyze these two articles that are linked on the same topic because actually both articles try to show the effects of the implementation of music therapy on patients with very specific diseases such as cancer, diabetes, Parkinson, anxiety, and depression. So as you can see, these are not just physical diseases. This therapy also can be applied on mental diseases, and which is very important information here. So now I would like to move on to the content of the articles. Basically, when if you check the content of this article, you will see that both of the articles just use headlines. These articles do not use any kind of subsection or subheadline to explain the information of this research. On the screen, you will see the difference between the two articles. For example, at the left hand, you will see that the article number one has three different headlines, while the second article, on the other hand, on the right hand of the screen, you will see that each article has six headlines. With it's a big difference, but actually, none of the articles use any kind of subsections. Both articles are very specific on this point. So we can move out to the population, which is a very important part of the research. At the left hand, you will see the population that was used on the first research. On this research, the population was between children since 9 years old to 15 years old and adults since 45 years old to 60 years old. On the right hand, you will see more information but related to the second article, which actually used different population compared to the first one. This research was focused on children since 1 years old to 15 years old and adults since 30 years old to 60 years old. Also, it is important to say that all these populations has similar diseases, like I told you on the beginning of this presentation: cancer, diabetes, anxiety, Parkinson, depression. Um, are some of these diseases included on this research. But now I would like to talk about the treatments. Now, if we take a look on the left hand, we will see that the treatments used on the first research consist on three different points. So the first point is singing and playing some instruments directly with the patient, between doctors and patients. The second option was using relaxing music while the patient were getting painful exams. This option has very great results. And finally, we have the vibroacoustic therapy. If we compare this information to the information that we have to the right hand, we will find some differences. So let's analyze what we have here. On the right hand of the screen, we have the treatments that were used on the second research. And we have these two main points. The first one is the use of patient experience to create new songs. And the second one is the relation between child, adult, and music. And this is something that just happened on this specific research. These specialists decided to create a relation between these three important concepts: child, adult, and music. So they request to an adult that has anxiety to sing a song to a child with the same specific issue. And the results are fascinating actually, because singing that song help both of the parts, to the adult and child as well. So it's a very important option here. Then we can move on to the results and discussion. And actually, and as I told you before, the results are very satisfactory, showing us that actually the implementation of the music therapy is one of the best options that some diseases has if we want to avoid using drugs. As you can see on the left hand of the screen, The second most important result was that listening to music was also found to be more effective than prescription drugs in reducing anxiety. And it's very important. And if you take a look on the right hand of the screen, you will see that the music also reduces the stress on patients with anxiety on the second research. What means that on both cases, we can avoid the use of very specific drugs and we can try these new treatment options. Finally, and as a conclusion and final words, I would like to say that the music therapy is a big opportunity for all of us to stop using some drugs or treatments that just leave negative effects on the patients and start using these new treatments that can offer you a better experience, that can help you a lot to overcome any kind of disease, and that does not consist on any kind of a specific drug that can damage you or any other patient with the same disease.